part of the message that codependency brought, which was don't support, don't constantly enable, don't rescue, don't caretake for men who are troubled. Self-actualize, focus on yourself. All of that really fit into the mode and the period of thinking around psychotherapy and the women's movement in the 1980s and 90s. But unfortunately, number one, codependence has never been proven as a model or as a diagnosis. It's just never existed in our diagnostic manuals. So while it did take off as a huge cultural phenomenon, it never really cut the mustard when it comes to clinical expertise and activities. So people do all kinds of things they call codependency treatment. And I have gone back to and want to go back to what is codependence, what is codependency treatment, what didn't work about it, and how can we improve it with a new model. Prodependence is not a trauma-based model. It is an attachment-based model. It is an attachment-based theory of human dependency, which simply states that those who partner with an active addict or a troubled person are simply loving people caught up in circumstances beyond their ability to healthfully cope. Nobody trains anybody how to love an addict or how to love an alcoholic. They just don't teach you that when you're growing up. And so prodependency really speaks to that all of the activity by a partner, whether it's rescuing, enabling, caretaking, fixing, helpful or not helpful, that all of that is seen under prodependence as a positive response to their attachment to someone that they love who is failing. And who wouldn't do anything they could to try to help a failing loved one if they started to fall apart? And for some reason, we ended up, and we can go through the reasons, but we ended up pathologizing those people in a way that might simply be unnecessary.